This week, I would like to share with you what to expect at your first doctor's visit with urogynecologist and how to prepare for it. First, make sure that you fill out all the forms that the urogynecology office sent to you. Write down all the surgeries that you ever had, especially on your stomach. Write down all the medication that you take and its doses. Ideally, you should fill out a bladder diary for at least 2 days before your appointment. It doesn't have to be right immediately before your appointment or 2 consecutive days. It could be 2 different days whenever is convenient for you. You can learn how to fill out the bladder diary in my prior video. When you come to the office, expect that you will be asked to get undressed from the waist down. When we urogynecologists perform the pelvic exam, we usually look at the quality of tissue, at the strength of pelvic floor muscles, and look at any changes in your pelvic anatomy, like prolapse or some tissue laxity that would suggest the etiology of your urinary urgency and all your urinary symptoms. You might be asked to cough, to bear down, or even jump, and the urine might come out during those tests. Don't worry. If it happens, it's actually make our job as a physicians so much easier because it tells us that you also has another type of urinary incontinence, a stress urinary incontinence. And I will tell you about that type of incontinence in my next videos. So after you do a pelvic exam, usually you will be asked to empty your bladder and the urine will be sent for urinalysis to check for any blood cells, any signs of infection. And this test might take 1 or 2 days to come back. Your bladder will be checked to see how well you empty your bladder. And it can be done with a small ultrasound or with a small catheter that inserted in the urethra. Both tests are basically the same.